So really the future is now. And in the past, before profilometry, before a few years ago for me, the part of the eye that we were fitting was the only part of the eye I did not know the shape of. I knew the shape of the cornea and I knew the shape of the retina and all this, but I'm putting it on something blindly and using only art. And it's nice to put science there to get a better product and something better for our patients. You can't do a free-form lens unless you have profilometry. And using the Gaudi, using the Boston Sight Smart 360, the ScanFit Pro, these are amazing lenses, probably for everybody, but especially on those cases that need them when we have this totally irregular asymmetric sclera. It's wonderful. Yeah, I believe, the first part of you're going to do anything more complex, which is a multifocal or HOA corrections, or even just general corrections, the better fitting the lens is, the better it's centered, the better it's not tilting. All these things, the vision is vastly improved. And we know that you put on just the best fitting scleral lens already, you're taking care of things. And now if you want to start adding decentered optics and decentered multifocals, you've got to have a more technologically advanced lens to get to that point. ESP and scleral profilometry has completely changed the way I fit lenses. And I'll never forget back when I first started using it, and a couple of consultants said to me, "Hey, doc, we've noticed your fits are so different now than previously and so different than anybody else. But we've also noticed that it's working and you're not doing redos and we're not doing all this stuff." And so we have to take the science and use it and get a better lens, a healthier, better vision, and in a much more efficient manner using the profilometry. And it does this in a very quick way. The capturing is easy and quick. It's easy on the patient. And then almost importantly, as important or more importantly, is the intangible parts of it is educating and demonstrating to patients. Every day when I use it and I show the patients the 3D image of their sclera and their cornea, they sort of start to understand, and then because they need to be part of the journey and be part of the whole process, as we know. And that's a huge factor for with the use of this technology. And also in a, again, in a business sense for marketing and bringing patients to my office, when they see that I have this technology, I think they're going to pick me over the next guy. For me, not having profilometry actually comes up on a fairly often basis. I do some training for some of the manufacturers, and I go to an office who does not have scleral profilometry. So I take a step back. I have to go back 3 or 4 years and do it the old school way. And sure, it works well. And if you follow the guidelines and the predicted values of these lenses, we did a good job for a lot of years. For 10 years, I fit lenses this way. But I feel it's a step back. Now I can still do it, and now I'm 90% art and a small percent of technology and science, versus with scleral profilometry, I'm 90% science and then throw in my art after that. So it's tough. It's tough, but I wouldn't go back. Maybe I should get a second one in case someone takes that first one.